viewers. Thank you for joining us today. Today we will be discussing about aspects on topics that intrigue every person's mind, especially that of parents. Like, are our children safe? When is the right time to let them go to school? Or are we all safe? With the pandemic looming around, with scared traces of solution inside, the answers to these questions are beckoned by all of us. Hence, to allay our fears and enlighten our minds, we have one of the brightest minds in the field of medicine, Dr. Naveen Thomas. We welcome you, sir.
Thank you.
Dr. Naveen is a pediatric surgeon by profession with the MPhil in hospital management from BITS Pilani. Having graduated from CMC Vellore in 1988, he joined Baptist Hospital. He has worked as an associate clinical lecturer, Sydney Medical School, and as a fellow in pediatric transplantation from 2009 to 2011. And not to forget, he himself is a principal assessor of NABH, a nationwide quality accreditation board. Presently, he is a director, CEO in Baptist Hospital, and he continues to serve as a general and pediatric surgeon. It's a pleasure to have you today with us, sir.
Thank you so much. Thank you.
So, starting with the questions.
Yes.
Sir, considering the number of rise in cases and vulnerability of children, is it wise to reopen the school?
Yeah, whether to start the schools, reopen for children to come into the schools or not, I think it's a very good question. Now, see, it is out of our purview, in the sense the government has been doing a good job, I feel, at least in Bangalore and in Karnataka, taking the right decisions, having conferred with the specialists and epidemiologists and doctors and bureaucrats. So together they have been deciding. So as of now, they have said wait till July, we will come up with fresh guidelines. And it was just yesterday that the HRD ministry came up with with the statement that they'll probably start only in August, and it may be by after August 15th.
Okay.
So, the timing of it depends on. As of now, they've said wait till July.
Okay.
Yeah.
Moving on, many schools are having online classes to continue their curriculum. Why not continue the same? Are there any negative points that we have to keep in mind?
Yeah. See, there is a problem in continuing with just online classes, because there is, the interaction with other children.
Right.
You interact. There is a development of emotional intelligence, in a sense. You interact, you fight, there is conflict resolution, and you learn how to get on with life. So those are important skills. But then we are not the choosers in this, because this situation has come upon us. And, they have studied in Brown and Harvard universities. They had almost 80,000 students who were studied. There is one mathematics learning software called Zearn or Zern.
Okay.
So what they did was to compare the student development perception scores before the online thing started and after. But what they found was that from poorer sections of the society, there was almost 50% drop in the perception and learning capabilities and scoring. Okay. From the slightly higher, richer areas, they found that there was a drop of 1/3 of the student perception. So that was the issue.
Okay.
So the learning is not as good as when there is a direct interaction. That is a given. That's something that we know. But then, going back to your last question, is it the right time to do it? Yeah. Right now we are in the phase of an accelerated increase in numbers. every day we wake up, open the newspapers and realize that the previous day was the highest ever declared in India, and last few days it has been above 10,000 new cases diagnosed every day. So we are in that phase. So this may not be the right phase. There was someone who said, the right answer for this is hurry up slowly. Maybe that is the right answer. We have to hurry up, but then slowly and wisely. The Dr. Fauci of the US CDC, and he was asked this question, what are the timelines? And the answer he gave was very interesting. He said, we don't set the timelines, it is the virus which sets the timeline. And just to give you the background, 30th of January, that was the first time India had the first case of coronavirus. A man from Wuhan who had studied in Wuhan came to Thrissur. He was diagnosed to have that. After 3 months and 1 week, the number had reached 50,000. So the first 50,000, it took 3 months and 1 week. The next 50,000, the 1 lakh mark, came, just within 13 days. So 3 months, 13 days, then it reached 1.5 lakhs in 8 days. And 2 lakh mark was, came up in a very short time. And now we have crossed the 2.5 lakh number, But this is the number of diagnosed cases, just the tip of the iceberg. But I just wanted to say this is in that phase of accelerated increase in numbers.
Right. Moving on, how serious is this COVID-19 if you keep children in mind and children in picture?
Yes. Fortunately, it is not, as serious as in adults. So, having said that, we know that there are some episodes. Actually, we've had even, a reported death of a 45-day-old infant, and there was the, 14-month-old baby who was infected. So, but those are fortunately very few. But overall, they are not the ones who are highly at risk. Now, the 72,300 people were studied in Wuhan, the first article which came in Journal of American College of Physicians, it's the JAMA. This article said, I have noted it down, only 1% of those affected were from 0 to 10 age group. The next 1%, 1 more percent from 10 to 19 age group. All the rest were above 19, so 20 and above. And they have also shown that the children tend to catch this disease much less, and children tend to become sick much less, and they transmit also. If I am a child, my likelihood of transmitting to you is much less. But there is a condition called the multi-system inflammatory disease of adolescents and children, and it's the Kawasaki disease. That's the confounder. Suddenly you get some of these very sick ones, but again, fortunately, this is very few among those who are young.
I hope that's helpful for the parents who are really paranoid about the thinking.
Yes, there is one question there. Mr. John Kumar. Yes.
Is it advisable to start school without any vaccination found for COVID-19?
Excellent question, I think. The vaccine as such, there are multiple trials which are going on. The human trials have started also. but the earliest it may come is only by the end of this year, earliest. Even after that, there has to be a mass production. When will we get it? It's anybody's guess. So is it by summer next year? But so it is a matter of saying, are we ready to sacrifice 1 year of learning? So it's a fine balance. It's a fine balance. So anyway, there seems to be general understanding and acceptance of the fact that yes, by the time some more herd immunity has built up, it will be definitely after August. Is it September? Is it October? We don't know. That these are the questions. Or can we start sometime in August with all the precautions in place? Those are the questions. We will discuss those things about the precautions.
Yes.
What can be taken in case we start anytime now? But that's an excellent question.
Moving on, talking about the international experience, like international community, how has the international community managed about this school reopening thing?
Yeah, again, it's very interesting to look at the international experience in this matter. What they are saying is that 1.72 billion children are affected in the entire globe. So we have a lockdown announced in 134 countries. Right now it's ongoing. And I have noted it down. It is in 38 countries, they are partial lockdowns.
Right.
So this is among the 195 countries of the world. So, Denmark, Norway and Germany were the countries which they lifted the lockdowns. They were the pioneers in lifting those lockdowns. Now, France opened it, and then they had to rapidly shut down again because they found about 70 infections among those who came back to school. So that was a problem that they faced. Sweden, on the other hand, said above 16 years, let them continue online because they know how to interact online. All the rest, the children, let them come back to school. So it has been really varied. Having said that, it is important to note that we have 1.3 billion people. We host 1/6 of the world's population. So we add on 1 Australian population. That is the number of babies we make every year. So it is the net addition to our population equals 2 Singaporean population. That's the net addition after taking away the deaths. So simply there is no comparison between some of these countries, and we have a huge number. That is our strength, that is our asset, that's also our challenge. So the population density also is an issue. Indian population density is something like 455 per square kilometer. In the US, it is only 36 per square kilometer. So we are more than 13 times more as far as population density is concerned, with much less land mass. So that is what we have. That is the challenge we face. So some of the measures that these Western countries took, it may be more difficult for us, but we can do that. It's also noteworthy to say that 27% of our population is less than 14 years of age. 2018, these statistics came out. Whereas in the US, it is 18% of the population was less than 14 years. So we have a huge number. So, our dynamics, the challenge that we face is much bigger. So that is another question. You want to read that?
Yeah, that connects with the last question we have.
Yes.
If at all schools reopen, what precautions should the school management keep in mind, as well as parents should keep in mind?
Excellent question. Ms. Shireen Kaushik has asked this. Thank you, Shireen, for asking that question. I think it's a very fine question.
Yeah.
You know, we are in this new era, unscripted, uncharted. You know, we are unlikely to say, you remember those days we used to shake hands and you know, with these masks in place. We are not wearing masks, that's for the camera's sake.
Yes.
But then we are supposed to. And those are the things that we have to do even in, you know, when school starts again. I have noted down some things saying these are the precautions that have to be taken even when it starts. Now, let us start with transport. We have seen these crowded, overloaded auto rickshaws and tempos and cars in which you know, the children have been carted to schools. That won't be possible anymore. So they will have to have more space. Obviously, that will mean more expense, that will mean more number of vehicles transporting them. And when they reach the school, obviously there has to be a temperature check. I think the most important thing will be education of the children and the students, saying, if you have cold, cough or fever, please do not come to school. That, you know, so it also means that we have to take away some of these prizes for 100% attendance.
Right.
Because if you do that, if I'm a child, I may be tempted to say, it doesn't matter, I have a little cold, let me still go back to school, because I don't want to miss that prize. Or penalizing for suddenly not coming. You know, that may have to be altered also. And our schools have been fantastic. They know, you know, the teachers and the managements have been very good. They know what is important in this scenario. Though we must encourage attendance, this is a different era where, you know, as Shirin asked some time ago, till the vaccine comes in place, we have to make sure that these things are adhered to. Now, once you reach the school, what happens? There has to be a temperature check and you know, hand sanitization, and you know, everyone cannot crowd together. Is it going to be in 2 shifts? Is it going to be on alternate days? Those are the tough questions that the managements will have to cope. Somebody was saying the distancing part of it, it has to be you know, like in exams. Ideally 6 feet is the distance between children, but that may not be possible. At least 1 meter, 3 feet. So it is 9 square feet for every child. So that is a tough ask. In many of our schools which are crowded, that is a tough ask. So we'll have to use the you know, meeting spaces, the, you know, assembly halls, probably even open air spaces, and also stagger the children coming together so that distancing is possible. Now, what happens during classes? You know, the intervals, the breaks, tea breaks, they will have to be staggered because you don't want them to come together. School starting may have to be staggered, and school finishing time may have to be staggered. So that is a tough ask, but our schools, I'm sure, will be able to cope with it. And in some of the Scandinavian countries, what they did was to have hand hygiene breaks every hour. They had to wash with soap and water every hour. Mask is a must. we have to teach them, saying it's a new reality, we have to use that. Now, there are some precautions in the sense, with a mask, can I take part in PE or games? You know, there was this girl who came to me and said, I was playing and suddenly I blacked out, wearing this mask, everything went black. Well, we know that, if with extreme exercise, the oxygenation, and more important than that, the CO2 levels does go up. So extreme exercises may not be possible, but yes, some amount of PE is possible, but masks are a must. This is something that we must adhere to. And toilet hygiene, sneeze etiquette, cough etiquette in school. Those are things that we have to teach our children. If you suddenly sneeze, if you have a mask, it's well and good. In addition to that, you can just keep a kerchief or a tissue in front and dispose it off in a hygienic manner. And these are things that we must teach them. And if you do that, to wash your hands again. Important question. But much to be done, very challenging. It is possible, and I'm definitely confident that our schools will be able to tinker with this. So probably a hybrid model of both the direct teaching as well as maybe on alternate days or whatever it is, online teaching modules may have to juggle with this kind of new paradigm. It's a paradigm shift. We will have to adjust because we don't have an option. We are not the choosers. There are some more questions.
We have a question from Mr. Ramana Krishna. I logged in late. Can we send asthma child to school during COVID?
Yes.
And as a teacher, I have seen parents send children to school after giving crocin.
Excellent question. Excellent question. Mr. Krishna, if, about asthma, if someone has, severe asthma, which really troubles the child, it may not be the best thing to have the child over. So he or she suddenly comes into the high risk category and may have to check with the pediatrician or the physician before that child comes to school. So, but there is the milder variety, the reactive airways disease. Many in Bangalore have this problem.
Yes.
And if you ask all of them not to come to school, half the school population is removed from school rolls. That may not be possible. So yes, severe asthma with breathing difficulties, they should not come. And the other question he asked.
Can we send, there are parents who are sending children with crocin after giving crocin.
Oh yes, this is a no-no. So we have to educate them. We have to tell them, if you have fever, cough, cold, please do not come. So we will not penalize you, we will not reward you if you come. We won't penalize you if you don't come. And this is something that we have to educate. But what happens? I think what you have asked is a wonderful question, because there are some children who fall sick while they are there. Somebody comes with cold and cough, fever, while in school. He was all right in the morning. What happens? So we will have to have an augmented capacity of the sick room, and there has to be a 6 feet distance between children there. The child must wear a mask, as well as the teacher or the person who's looking after the child. And obviously you'll have to inform the parents, and if you have a nurse or a doctor, you will have to take care. But it's important to have the person looking after having a face shield, probably in this case, N95 mask. Generally, it's a cloth mask and that's enough. But the person looking after sick children may have to have N95 mask. Later on, we will talk about these too.
The next question is by Elizabeth Benjamin. Do you think it's wise to reopen schools even for classes 6 and above?
Yeah, again, it's a good question. So, class 6, you're already 12, 12 years old, you're teenager, and we know that less than 19 years they are low risk category. But having said that, they are not no risk category. They're just low risk category. Now we will just wait for the government guidelines, because they have been consulting the experts in this field. So they will come up with guidelines which we will accept, and we can rest in that fact that it is possible. So we will wait for those guidelines.
Yeah. So the next question is by Monty Lobo. Is it necessary to self-quarantine after discharge from hospital in case there are small children at home?
Well, good question, Monty. The small children, they get infected much less than adults. But yes, you will have to till you are declared free. If you have been diagnosed to have COVID, till you are declared free of that, it may take 14 days, it may take 21 days. Till then, do not mix with them as much as possible. Now, physical distancing, because I want to twist that term from social distancing to physical distancing. Physical distancing is not possible in many of our homes. It's a luxury in many of our situations. But then you must wear a mask. Ask children also to wear a mask at home if there is home quarantine happening right at home. So hand hygiene, don't touch your face. That is the best that you can do. And commit the rest to God and move on, because you're not the chooser in this. There is another question.
Okay, Ganana Chitra. The question is, nowadays most children are playing with other children in the neighborhood. Please advise if it is safe or we need to restrict children to be away from other children.
Well, it's a good question, Ms. Jnana Chitra. It is not nowadays, it is from time immemorial that children always play with other children. You can't change that behavior. But I think you have a point. We cannot allow them to be in large crowds. This is something that we'll have to teach them. Even while playing, keep some distance. No hugging, kissing. No not being with children who have cold or cough. And you yourself, if you have cold or cough, it's the parents' responsibility of saying, sorry, you can't go out to play. And if you have that, we will have to make sure you are totally well, maybe a week in extra time after you become well, if it is mild cold and cough, that before you mingle with other children. But then very difficult, isn't it?
Yes.
To tell a child, thou shalt not play. You can't. You are telling a child, don't be a child. Well, tough question, but then yes, when they are symptomatic, they cannot. Large groups playing together is a no-no. Finding a fine balance, difficult, tough task, but then we'll have to do that. Yes, that is.
Okay, the next question is by Jyoti Kaneshwar. Sitting in front for the screen for online classes for 4 to 5 hours, what is the impact of this on child's eyesight?
Good question. Now, the information that we have is that, the vision of the child, visual acuity is not affected by having screen time. But there are other problems. In the sense, as it is, children are being addicted to screens, mobiles and other things. So will this period reinforce that behavior? Will it make them less social? Yes, it is a problem. I don't have an answer. Neck issues, because children may, in front of the teacher they are all straight, they are okay, but when at school, at home they are in contorted positions, they're not looking at the screen in the right way. So positional problems, muscle pain, neck pains, and some of we also know that there are increased number of psychological issues, because they don't have the normal inputs of interactions. So those are the problems. But vision loss, don't worry about it. That is not something that is true.
Okay, we have next question by Mr. Aruna Kumari K. Should we be given N95 or a regular mask to the child?
Now, N95 mask, Ms. Aruna, it's a tough thing to wear. You feel muzzled after some time. So, and also N95 is expensive. It is in short supply, though the situation is improving. So general advice by ICMR, advised by WHO, is that N95 is not what is advised for the general public. What is advised is a cloth mask. Now, just day before yesterday, WHO came up saying cloth mask of 3 layers is what they would strongly recommend. Single layer is not advised, at least double layers, but WHO has recently said 3-layer masks are better. Difficult, but then that is something to use. And how do you clean that? Just dip it in soap solution for 5 minutes, that's enough. Then all the COVID is dead if they can't replicate anymore. So that's the good part, you can reuse. Now, in the sick rooms at school, you could use a surgical mask or the medical mask. And if in a hospital situation, health worker or the person looking after sick children in the school may wear N95. That's okay. That's okay. Yes, so that's the answer for your lovely question.
So the next question is by Mr. Prakash. Ultimately, do you really think schools should reopen? Don't you think it's better to have online classes till the COVID-19 vanishes, or at least till the vaccine is available to the public?
Well, again, a good question. It's been repeated, but that is the burning question. So I don't mind repeating the answer. That is the ideal, but you are really balancing between, what is the loss of learning that the child gets versus this. Again, fortunately, children are less susceptible to catch the disease, and if they catch, of becoming very sick, and if they become sick, of transmitting. So all these are less among children, but it is not zero. So question is valid. Ideally, yes, let the vaccine come, but we don't know when. So it may take a long time, maybe at the end of the year, maybe next year, by the time this becomes available. So we have to really balance the pros and the cons before we take that decision. But the government is seized of the matter. We believe that they'll advise us accordingly.
Moving on the next question by Ashwini Das. My daughter is 3 years old. How about sending for preschool, as they can't understand what's hygiene?
With a 3-year-old daughter, I'm sure, Ms. Ashwini, you are happy and busy. So, she will keep you on your toes. I'm sure you are healthy too, because they will keep you on the go. But sending them to preschool, is it advisable? Again, the answer will parallel the previous answer. If that preschool setup is not crowded, very few children, and they have been able to establish all the norms, when it is allowed by the government, yes, you may look at that. But then, if it is possible, to look after at home, if it is a luxury you can afford, yes, that is fine, because 3-year-old will not miss much, by not going to school in that sense.
Next question by Christina Daniel. Can sports activities take place in the school or not?
Good question. With the mask on, it is difficult to do a heavy exercise. PE, physical education, is it possible? Light PE is possible. No intense running, no intense games. So the teachers will have a task on their hands to fashion it accordingly. So the answer is, provided it is possible to have less intense activity, yes, you can take part in games, but no intense activity, because you cannot take away the mask when you are with other children.
We have next question by Soumya Susanna. Doctor, do you think reopening schools is a risk worth taking during this pandemic? Whatever precautions are taken, as parents, we will be very concerned about the rules being actually followed in the school.
Yeah. Soumya, I think you represent a whole lot of parents who are asking this question. And yes, I think the time will come to reopen with a lot of specifications and precautions in place, but it will be after the peak of the disease curve is passed. There is plateauing, there is actually decrease in the numbers, and when that happens, when the government allows, that is not imminent. I'm sure it won't happen in the next couple of months, but when that happens, when the plateauing happens, with all the precautions, we may be able to take those risks, but we can only mitigate that risk. We can never make it zero. Hopefully, we will be pleasantly surprised by some vaccine or drug which is very effective.
Okay, the next question by Krishna Rao. My daughter, 16-year-old, and son, 12-year-old, wants to go for cycling around the area. What do you suggest, please?
Outdoor activity where there is no crowding, it is okay. In fact, it is better than going to the mall or a crowded shop. So cycling is all right, provided he is not surrounded by a large crowd. But he or she, you said daughter, isn't it, or son, has to wear the mask. Cloth mask is enough. Hand hygiene, cloth mask, keep away from crowds, let them cycle.
Okay, so the next question by Manjunath Sri. Is it safe going close to the baby of 5 months as we cuddle or kiss the baby?
Yes, kissing, cuddling, only parents. If you're in the same family, please do it. Otherwise, keep away. You'll have to wait till the situation clears up. Flying kisses, safe. Yes.
So the next question is by Mr. John Kumar. Doctor, a lot of parents send kids in private school vans, which might drop other kids too. What precautions should be taken, even if social distancing is maintained?
Yeah, again, education will be the most important. First of all, educating the parents of these children of the importance of wearing masks, hand hygiene, and avoiding going to school when the child is ill. That is a social responsibility that parents have to learn, and I hope that is possible. And overcrowded transport is something that has to change, so that means financial implications, but we are not the choosers.
So the next question is by Lucy Margaret. How long a child should be on mask?
Yeah, till we have the mask, we have the answer to this question, in the sense, but in school, right through. So fiddling constantly with the mask is a problem. See, that is the problem of wearing something like N95. They will not be able to wear it properly. They will be uncomfortable. They will fiddle with it. The whole purpose is lost. Cloth mask, it is more comfortable. It can be, maybe you should send one extra mask with the child. If it gets wet or dirty, use another mask and send a paper cover into which the old dirty mask is put in. The other mask can be worn. The answer is all the time while they are with others in school. We don't have a choice in this matter.
So the next question by Aruna Kumari. If someone in the house is in frontline care of COVID patients, or a doctor or paramedical personnel in a hospital interacting with patients every day, what extra precautions should we take when kids are there?
Well, in fact, thank you for that question, but it is, keeping the kids safe is not the major problem. It is, if you have older folks, you have to be in fact more careful. Now, health personnel in general have been taught how to wear the surgical or medical masks while in contact with patients, and in high-risk areas to wear the N95 masks. And they also have been provided in most places with the appropriate personal protective equipment, PPEs. So as long as these PPEs are handled well and they are removed properly, and after that the hands are washed correctly with soap and lather, for 20 seconds, preferably 40 seconds. Once that is done, after removing the mask and the PPE, the person is safe. Ideally, change your clothes, and if you have worked in a high-risk area, take a shower before you mingle with others. But otherwise, with these precautions in place, it is safe. Now, let me tell you that being in crowded shops and malls and transports, in fact, that is equal to being in a crowded hospital situation, because here you have transmitters who you do not know, and they may not take those precautions, but in the hospital setting, probably precautions are being taken.
Okay, next question is by Mr. David. From next week, the worship centers are open to worship. What is your advice on precaution to be taken?
Good question. I think it's the next topic that we are going to address. Yeah. So, from today onwards, isn't it? I think the places of worship are open. Now, many people had asked this question. The counter question was, if you can have pubs, places where alcohol is given, malls and shops and everything else is open, why not places of worship? Well, maybe a good thing, good decision, but as you have indicated, obviously you are concerned about this. Concerns are genuine, justified, there are some precautions to be taken. Maybe I will list some of them. One is, again, no crowding. Now, as we had said earlier, it is, a 6 feet distance is the ideal distance, but that is not possible in a place of worship. So what we have said is that at least a 1 meter distance. So that will be a 3 feet. You need a 9 square feet for one person, unless you are the same family members altogether. That's okay. But there has to be a distance. Now, again, education is the most important. If you have cold, cough or fever, please avoid coming. You must wear a mask. There has to be a temperature check at the entrance. There has to be hand sanitizer, which is available. As somebody mixed it up and said, "Do you have sand sanitizer?" I said, "Yes, we have hand sanitizer available." And they have to wear the mask. They have to have, physical distancing, which is possible. And the number of people will be proportionate to the space available. You cannot crowd, and so that may mean that instead of having one session, you may have to have 2 sessions, so that people are not together. Now, those at high risk cannot attend. Above 65 and very small children, those children are not really at very high risk. People who have comorbidities may have to avoid. Now, if somebody becomes positive later, you will have to make sure, you will look back and say who all came into contact with this. Now, when we will address the temple, mosque and church situations separately also, but then, these are some of the guidelines which we have listed out, but the government has already come out with these guidelines. So important to keep our eyes and ears open.
We have one more question from the school perspective.
Oh, we are going back to school? Yes. We will come back and forth from school to worship place. We'll do that.
Please suggest some methods to maintain hygiene and safety measures at school.
Excellent question. Schools will have to provide hand hygiene measures, additional hand wash stations, preferably paper towels. Now, common towels cannot be used. Now, a good alternative to this is dryers, hand dryers. Now, if this is not there for some reason, instead of using a common towel, wipe on your own shorts, trousers or skirts, that's okay. That's better than anything common. Now, hand sanitizer. Now, even children, it is better to send them with small bottles of hand sanitizer so that they can use it. Some of the Western countries, especially the Scandinavian countries, had instruction to have hourly washing of hands. They have hand wash breaks where hourly they have to break out. So these are some of the things that you can do. Other things we had talked about earlier, but may I say, do all this, leave the rest to God. But it's not imminent. It will take some more time before the officials decide on this, because the time is not yet ripe. We are still in this curve. We will avoid, many of the risks. You can never make it zero, but you can mitigate this. Now, this is an example of cloth mask. This is a 3-layered mask, which is very good for most of the situations. Now we'll talk about the others as well. Yeah,
so the next question is by Shrikant Reddy. How long a pre-primary child can sit in front of a screen?
Yeah, Mr. Reddy, we used to say only 1 hour of screen time in the morning and 1 hour in the evening. That used to be the answer, but unfortunately during this season it can't be true. Obviously it will have to be a little more, especially in crowded areas where they don't have space to run around. What else will they do? But innovatively getting blocks and books and other things to engage them in, this will test the parents' innovation and the relatives' innovation. Easier said than done. But we used to say 2 hours max per day of screen time, but COVID times, unusual times, maybe we'll have to extend it further, but then left to the innovation how to engage them otherwise. But there is this real problem of becoming screen addicts. It is a real problem. We don't have the full answer for this.
So the next question by Mr. Krishna Rao. 10th class exams are restarting. What precautions to be taken?
Yeah, Mr. Rao, I think it is a very pertinent question. Just if you have a 10th standard student at home, you are the parent, hug that child and say, don't worry about exams. You do your best. We are with you. We are not going to eat your head for whatever. That takes away a big pressure on them. People are going through depression and anxiety and all sorts of things because of this. So this is not the end of life. This is not all of life. So, but encourage them to put in the best possible with encouraging words, and they need to take physical breaks in between. Maybe a quick jog. Maybe some exercise somewhere and come back, and they need to, obviously they have to work hard. We can't escape from the Indian scenario of competition. We have this, it is real, and but we have to temper it with the psychological pressure which already which is inherent during these COVID times. So wonderful question. When you find the answers, please let us know. But encourage your child, and that is enough. I'm sure he or she will do wonderful job. As somebody said, as long as there are maths exams in school, there will be prayers in school. So it will happen. Just do your best, commit it to God, and your child will excel, not to worry.
Moving on, next question by Mrs. Susanna. Some doctors are advising to take swine flu vaccine for the prevention. Is it available in India? Is it really prevention?
Quadrivac, or it comes out. In fact, every September the new version comes, and it does not take away the risk of contracting these flus, but it is available, and it is good to take that. Children, those who have comorbidities, diabetics, and those who are above the age of 50 are advised to take this every year. Children may be good to take. It is good to take because they are with other children, and they tend to contract these diseases. So far, it was advised for older people or anyone else with comorbidities. For the rest, it is an optional thing. But then, does it have any effect on COVID? The answer is no, it does not. But it's worth taking it, because when you have a flu, you're wondering whether it is COVID or is it just an ordinary flu. It is nothing else. So it avoids that confusion, reduces the incidence. Yes, check with your pediatrician. They will tell you what is appropriate. It can be given. Some more questions are coming on the screen.
So the next question is by Mrs. Savita. Can masks do a lot? Social distancing is too difficult for kindergarten children.
Yes. Kindergarten children are angels. They are not made for social distancing.
Yeah.
But then, Do you have those cute little masks for them, and will they wear them? Very difficult. If you can manage them at home, that is the best, but then masks are available. You can over time teach them how to do that, and even they learn. Even they learn how to wear masks. They know how to open a computer, log out and all that. So they can learn how to wear a mask. Masks are important. Initially, WHO said it is, masks are important if you have, if you are symptomatic. If you have fever, cold, cough, wear a mask. If you are with another person who has fever, cold, cough, make them wear a mask. But now, the recommendation is for everyone. Outside of home, wear a mask.
Okay. We have one more question by Mrs. Lucy. If it is so free breathing, will it be difficult?
Isn't it difficult to wear masks?
Okay.
Okay? Yes, it is. I don't like masks. You have company. But then we get used to it. So, it has become part of the uniform. Wake up in the morning, and just before you go out of home, you take your wallet, you take your mask, wear them and get out. It is difficult. And mind you, when in the hospital situation, especially high-risk areas, they wear N95 masks, which are very snug fitting, difficult to wear. They have the visors, they have the full PPE, and it is very, very tough. But our nurses and doctors have been doing that, and hats off to them.
The next question by Mr. George. What advice would you have for families, institutions and training centers taking care of individuals with special needs, Downs or autism spectrum CP?
Yeah, again, very good question, George. What you have mentioned right now, they may not come into the high-risk category unless they have associated problems. But, for example, those with Downs, some of them can come into the high-risk category. And for them to make sure that they adhere to all the precautions is a little difficult. You have, you have a problem, a challenge at hand, but then this is something which can be done. And many of them have done this. Younger folks among them are low risk, but there are those with associated medical conditions. Yes, there is a problem there.
Okay, we have the next question by Mr. David. If schools are open, what hygiene measures to be taken by parents after their return from school?
Boil them. Good question, Mr. David. I think as soon as they come home, the mask has to be removed. Dip it in soap solution. That will wash hands. Take off the shoes. That's enough. And obviously, uniform has to be changed. And maybe we must get one extra set of uniforms. Instead of 2, it will have to be 3. So, so that it can at least be dipped in soap solution. That's enough. 5 minutes of soap solution, that's enough. So, have a bath soon after coming from school. That'll be good. But hand hygiene, not touching the face, again and again, keep repeating that. That is the most important. Don't worry about the rest. So that will be the most important.
Right. Moving on, the next question by Mrs. Ashwini Das. Seen many articles saying for a child it suffocates wearing mask. Is that true?
Yes. The answer is yes and no. Somebody was asked, do you have difficulty in making up your mind? The answer, he said, sir, the answer is yes and no. So that is the answer, because if the child is a preschooler, it's, we have to supervise their wearing this mask. Otherwise, they can get into trouble, or it can be ineffective. Now, in general, cloth masks, they don't suffocate. You don't like it, it tickles your nostrils. Believe me, it took some time for me to get used to wearing it. I don't know, Sophie, did you have difficulty?
Yeah, of course. I think I'm still having the difficulty.
Okay, you'll grow up. But then it is something that you learn to do it. We're not the choosers in this, but there are as long as it is nicely fitting, you will learn how to do that. But again, it is not as bad as the N95 ones. Even N95, the medical personnel, they get used to it.
The next question by Mr. Tibu. Some patients there is no symptoms, but finally some are getting heart attack due to COVID.
Well, heart attack due to COVID, I'm not too sure about that. But then there have been issues, yes. Myocarditis due to COVID, that has been an issue. And that can lead to ischemic heart disease. We will get a cardiologist to talk about this sometime later. But that is an issue. The other problem is, because of this season, they don't access medical care early enough. I have a little discomfort, but I'm scared to go to the hospital. I sit with this chest pain, it becomes a real big episode. It is too late. That can happen. Medicines not being appropriated, taken on time, that can lead to this. Uncontrolled diabetes and hypertension leading to myocardial infarctions, yes. The other thing is, they have also noticed that the overall health level decreases because you don't exercise, you are sedentary, you are sitting at home. And what do you do when you sit at home? As somebody said, I feel bad for those food stuff which sit inside the fridge very cold. I have to give them company, and you go and open and munch. You tend to put on weight. So all these can contribute to this. Well, the other problem is there is a general increase in anxiety levels. So that also adds to the already pre-existing condition. So all these are confounders, but they are real. And thank you for that question. So we have to encourage people to be on top of these.
Okay, the next question by Mr. Thomas. How to teach children about wearing and removing masks? What is the tip for spiritual leaders as they face a huge crowds in places of worship, irrespective of religion?
Yes, good questions. Thomas is a good name. I think it's a very important question. Now, if you are wearing a mask and you are fiddling with it all the time, you have, the hand is contaminated, the mask is contaminated. So, it's important to take it off, from to untie or undo, and without touching the middle portion, fold it up and put it into soap solution or into paper covers, and then take it to a place where you are going to put it into soap solution. So that's important, to teach them how to remove it. It's very important. I think that is something that should be done. We fail in our responsibility if we don't take care.
The next question is by Joseph Peter. Okay, it's by Mrs. Veena. Kids below 6 to 7 years have a habit of putting any toy on their hand, sanitized hand sometimes, in mouth, knowingly or unknowingly. So could you suggest in this aspect, please?
Yes, I think it's very pertinent because they tend to experiment. Isn't that wonderful? How babies and children are made, they're constantly experimenting. That's how they learn. That's how their brains develop. But then during this season, you don't want them to to be experimenting too much when they are with others. Now, that is why common play areas have come into a question mark, so because they may put things into their mouth and handling it and all that. But if it is your own toy at home, that's okay. Sanitize it in between. Don't overdo it, but it's okay. And we'll have to slowly teach them, but you cannot get rid of that habit of putting things in the mouth. It's okay. Do your best and leave it. And with prayers, send your children into the day.
So the next question is by Mrs. Angela. Since kids are not allowed to play outside, their time in front of TV or mobile or laptop has increased. What precautions or hygiene to be followed to protect their eyes as much as possible?
Yeah, we addressed this some time ago, Ms. Angela. This is a very difficult task to make sure that they don't spend their entire life through the day, glued to the screen because they have nothing else to do. But then encouraging them to read something from the books and other activities, play Ludo, play Uno, play anything as a family, bring in some excitement. Easier said than done. I know it's difficult. I've been only partially successful in the past. But then, these are challenging times for parents. And I'm sure, there's a huge responsibility and you feel unequal to the task. But I'm sure you will innovate and you'll be able to share with others what you were able to do, how you were able to manage. There are more questions?
Okay, is it advisable to take kids or elders to place of worship?
As of now, the advice is that children, I think the age is specified, please check in the government guidelines, children and those above 60 are not advised to go into the places of worship. It is understandable, above 60, they come into the higher risk category. In fact, they are the ones who want to go to these places of worship, but have online services or online facility for these people. But this is an issue. Those with comorbidities, diabetes and uncontrolled hypertension, severe asthma, other malignancies, those who are pregnant and smaller children, they are not advised as of now to go to places of worship.
So the next question by Mr. Andrew. Quadrivex, SP or PFS liquid, is this the one he's asking about?
Quadrivac, the immunize, there are a couple of things which are available. The Nasovac, which was actually the nasal spray, but the Quadrivac is an injectable one. This is available. So just check with your physician and make sure that is the right thing. Generally, it's around September that the newer versions come out. Because the viral strains differ every year. So anti-flu, Quadrivac, different hundreds of brands are there, but you will be able to check that out with your physician.
Okay, the next question, Mr. John. Are people with diabetes more likely to get affected soon if they come across COVID carriers?
Now, diabetes is considered a significant associated comorbidity. Now, uncontrolled diabetes would be worse. So if it is controlled diabetes, it's not so much. But it is not the fact that you catch it early. No, you catch it just like anyone else. The chance of catching it is the same. But then the chance of becoming sick, we know that 85%, 86% of those who get COVID, they may not even know they had COVID. It may be just mild symptoms. But 14 to 15% of people may get significant disease. About 4 to 5 to 6% need intensive care. treatment. But if you have diabetes, so this percentage goes up in your case. So yes, there is a role for being a little more careful than others.
Okay, the next question is by Mr. Gideon. Is it advisable to send pre-KG kids below 5 years to send to school?
Not right now, no. But then, hopefully time will come when it is possible, and they are almost, it's very difficult to enforce certain types of disciplines. If you're in a place where there are very few children and it is very possible to really follow them up, yes, it is okay. In fact, it is safer for them. The only problem is they may bring back that disease if the other child has it. Now, they have shown that their chance of getting the infection, and if is lesser than adults, if they get it, their chance of being more sick, it is less than adults. And very interestingly, if they contract COVID, their chance of transmitting it, even that is less than others. Very interesting findings. So the risk is less, but then, we tend to hold on to them a little more. That's okay. I think it's all right. They don't miss out much by means of missing out on learning compared to older children. So it's okay by keeping them at home.
Okay, so the next question by Molly John. Will not the students moving out of their homes in large numbers to attend 10th exams increase the spread of COVID?
Well, it is true, but then the institutions have been advised already to space them out properly. Again, with the mask in place, hand sanitizer, and physical distancing, it should be all right. Well, as somebody asked, can I do anything else? There is one more thing that you could do to add to these three, is to have a face shield or a well covered goggles which cover your eyes. That is the only additional thing that you can do to reduce it further.
Do we have any more questions? Okay.
Mr. Mann, yeah.
Mr. Joseph Peter, what do you suggest for running a hostel of 40 boys in the mission field in Odisha?
You're doing a wonderful job. First of all, I must say a big namaste and salute you for the work that you're doing. Again, it is the same things. Space them out, educate them, talk to them, keep talking to them. And if they are in one place, and if they have been adhering to hand hygiene, and make sure that if somebody falls ill, have a mechanism of isolating. That will be the thing to do. But otherwise, with all these measures, continue doing the good work that you are doing. But obviously, there are challenges.
Okay, so the next question by Mr. Prakash. I doubt that children are less susceptible to the virus as their immune systems are not as strong as the middle-aged adults. On what basis of research are you saying that they are less susceptible?
Excellent question, because when H1N1 came, it was wasn't it in 2008, H1N1, when that pandemic came, it was the other way. Children were more susceptible. It was in 2009, they were more susceptible. But so the large number of children and young adults got affected. But those above 50, they were affected less, but if they were affected, they had higher, morbidity and mortality. In fact, the chances of them dying of the disease was even close to 18 to 20%. It was big. But children were affected, young adults were affected more than this. Here it is the other way. It is, it's the older folks who for some reason get affected. We don't have the full information as to why, but those are the observations which are done. As I mentioned sometime earlier, in Wuhan, out of the 72,000 children, of COVID patients, only 1% were less than 10, 0 to 9, and another 1%, 10 to 19. All the rest were of the other age group. But in other countries and even in India, the statistics has been different. But still we know that children are safer than adults.
So the next question by Ranjit Sample. Should we have to wash our school bag and tiffin bags every day after use?
The answer is no, you don't have to wash. But if it is made of non-cloth material, you could just wipe it with soap solution. That is perfect. You don't have to do it, but that will be an additional precaution that you can take. But that's enough. That should be enough.
So the next question is by Manna. Doctor, you mentioned swine flu vaccine. Is it advisable to give for kids of aged 4 and 2 years respectively now or in September? The latest version comes. We haven't given them this year.
Yeah, I think what we'll do is, see, I am a surgeon, general surgeon and pediatric surgeon. We are the plumbers. We will have to ask the pundits, the pediatricians, the real doctors, before we authentically answer you. Maybe you could send us your email, email ID, we will answer that. I don't want to give you a wrong answer and they won't forgive me.
The next question by Mr. Manjunath. How should our interaction with a baby at home, if we are going out and coming in due to work? What to do if we have a COVID and are asymptomatic?
Yeah, again, the routine precautions: wash your hands, and if you've been in a crowded place, take a bath, change your clothes. Then don't worry, hug your baby, enjoy your baby.
Okay.
Yeah.
Okay, so we can move on to the next topic. So.
Yeah, I think we have already covered much of that topic already. There are many other questions which are streaming in.
Yeah.
We can see that on the screen, but then we will reply to you. We have your email IDs. Please quote your email IDs. We may not be able to answer everything today. We will cover a little bit more of the topic at hand and move on, but keep asking these questions.
Yeah.
Now, I may not remember everything to answer and give you the correct information, because I knew a good medicine for memory, but I've forgotten what it is. but then we will try our best. We will reply. And the other question we had was about you were talking about places of worship.
Yes.
Yeah, but it's already been covered in a great detail.
Yeah.
So
can we talk about in a separate way, talking about what should we do in temples or mosques?
Okay.
What precautions should they take while they're going to temples or on mosques, in different.
Okay. What do you do in a temple, in a mosque, in church?
Yes.
Different things. In mosques, for example, we have seen, our Muslim friends will know better. The prayer shawls, the prayer rugs, the advice is that you take your own personal prayer rug.
Yes.
May be difficult, but that may be something that we have to do. Now, in temples, some places where there is touching of the idols, and touching is a no-no. We will have to educate people not to do that. And again, for all three, it will be avoiding of clustering and clubbing together. Prasadam is advised that it is avoided during this season. Now, when it comes to church, what do you do about Holy Communion? That was something that somebody had asked also. And again, the common breaking of bread, you can't do that. You will have to, it will have to be individual wafers or pieces of bread which have been broken by someone who is asymptomatic, who is sanitized, and you cannot congregate together. It has to be delivered, and it cannot be the common cup. It has to be the grape juice, or in some places they use symbolic wine, small amounts. It has to be in separate individualized cups, so that the chance of spread is not there. So we'll have to tweak, adjust. As somebody said, we'll have to work around this virus. So, but we will, and we shall overcome.
So we have one more question on the school-going kid by Nero. By Mr. Nero. What about sharing food with friends? Classrooms are not enough for distance seating, and playing at school together.
Well, sharing food, ideally, no. But it's very difficult, heartbreaking to say that, isn't it? But we'll have to educate and say that this is something that you wouldn't want to do. But if they share, it has to be, not in general, after sanitizing properly and very discreetly, that it has to be done. And ideally, no. Definitely no sharing of water bottle. So, I won't give you this, Sophie. So it has to be the child's own water. So that is something that parents have to make sure that is done.
Okay. The next question is by Mr. John. Is it necessary to get a corona test done immediately after catching cold or fever?
The answer is, there is a short answer and there is a long answer. The short answer is no. The long answer is no. You don't need this. Secondly, they won't do it for you. The number of tests are much less than the demand. So it is not possible. So, there are criteria which you have to fulfill. Just a small cold or cough, no. But then if your physician decides that you have influenza-like illness, sore throat, history of contact with another suspected person, history of travel to, a place which is where there is high prevalence, like Mumbai or Delhi or any other place. Thankfully, Bangalore is not in the same club, but it may happen. It's been well managed, I must say. But, Chennai also falls into that. Ahmedabad falls into that. Yes, you are allowed to do that. If it is severe, any of these symptoms which are severe, they will take those swabs. Now, there is another condition called SARI, which is the acute respiratory distress syndrome, and influenza-like illness, high fever, body aches, sore throat, they will take, but they have their criteria. So mild cold, maybe you are allergic to somebody, don't worry. But then but it's good to isolate yourself as much as possible. And if you have a cold, wear a mask at home too, and make sure you use hand hygiene.
Okay, so I guess we've come to the end. I hope all your doubts and your fears, questions have been well answered. And thank you, Dr. Naveen, for taking your valuable time and enlightening us with your knowledge. And I hope your misconceptions or do's and don'ts all are cleared. Hope we've tried to answer all your questions. If you have any more questions, you can please send your comments or write to talk to us at bbh.org.in. We will try to answer as much as possible. Thank you for joining.
Thank you, Sophie. You've been a wonderful host, but must tell, I think many more questions have come streaming in, We won't be able to answer everything today.
Yes.
I'm getting indications from our technical people saying time up,
Yes.
and we have to do that. But then we will be in touch.
Yes.
God bless. Do your best. Commit the rest to God. Don't worry. This too shall pass, and we shall overcome. Thank you.